Imagine looking through a camera lens, and suddenly, part of the image goes dark. That's similar to what happens with retinal detachment, a serious eye condition where the light-sensitive tissue at the back of your eye, the retina, pulls away from its supporting tissues. This separation can lead to permanent vision loss if not treated promptly. In this video, we'll explore the causes, symptoms, diagnosis, and treatment options for retinal detachment, empowering you with the knowledge to protect your sight. So, what causes this separation? Retinal detachment can arise from several factors. One common cause is a posterior vitreous detachment, or PVD, which happens when the gel-like substance in your eye, the vitreous, shrinks and pulls on the retina. This can create a tear. Other causes include eye injuries, previous eye surgery, underlying eye diseases like diabetic retinopathy or uveitis, and even a family history of retinal detachment. Nearsightedness, also known as myopia, increases your risk as well due to the altered shape of the eye. Let's delve a little deeper into how retinal detachment actually occurs. The retina is responsible for converting light into electrical signals that are sent to the brain, allowing us to see. When a retinal tear forms, fluid from the vitreous can seep through the tear and accumulate beneath the retina. This fluid gradually separates the retina from the retinal pigment epithelium, or RPE, which provides vital nutrients and support. This separation disrupts the retina's ability to function properly, leading to blurred or distorted vision. The longer the retina remains detached, the more damage occurs, increasing the risk of permanent vision loss. Retinal detachment isn't incredibly common, but it's not rare either. About 1 in 10,000 people will experience it each year. It's more prevalent in older adults, particularly those over 50, as well as people with high myopia. As mentioned, a family history of retinal detachment significantly increases the risk. Certain ethnicities may also have a higher predisposition. It's important to understand that anyone can develop retinal detachment, regardless of age or general health, emphasizing the need for awareness and regular eye exams. Recognizing the signs and symptoms is crucial for early detection and treatment. Common symptoms include a sudden increase in floaters, those small specks or squiggly lines that drift across your field of vision. Flashes of light, like seeing shooting stars, are another warning sign. A shadow or curtain appearing in your peripheral vision is a telltale sign that the retina may be detaching. Blurry vision or a decrease in overall vision quality can also indicate a problem. It's important to seek immediate medical attention if you experience any of these symptoms, as time is of the essence. Diagnosing retinal detachment requires a comprehensive eye exam by an ophthalmologist. During the examination, the doctor will dilate your pupils with eye drops to get a clear view of the retina. They'll use specialized instruments like an ophthalmoscope to examine the retina for tears, detachments, and other abnormalities. Additional tests, such as optical coherence tomography, or OCT, and ultrasound, may be used to further evaluate the extent of the detachment and assess the condition of the vitreous and other structures in the eye. These tests help the ophthalmologist determine the best course of treatment. Retinal detachment can be classified into 3 main types: rhegmatogenous, tractional, and exudative. Rhegmatogenous detachment is the most common type, caused by a tear or break in the retina, as we discussed earlier. Tractional detachment occurs when scar tissue on the surface of the retina contracts and pulls the retina away. This is often seen in individuals with diabetic retinopathy. Exudative detachment results from fluid accumulating beneath the retina without any tears or breaks. This can be caused by inflammation, tumors, or other underlying medical conditions. Understanding the type of detachment is critical for tailoring the appropriate treatment plan. The goal of treatment is to reattach the retina to the back of the eye as quickly as possible. Several surgical options are available, depending on the type and severity of the detachment. Pneumatic retinopexy involves injecting a gas bubble into the eye to push the retina back into place, followed by laser or cryopexy to seal the tear. Scleral buckling involves placing a silicone band around the outside of the eye to indent the eye wall and relieve traction on the retina. Vitrectomy is a procedure where the vitreous gel is removed and replaced with a gas or oil bubble. Laser photocoagulation or cryopexy may be used to seal retinal tears or breaks. Your ophthalmologist will determine the best surgical approach based on your individual circumstances. Post-operative care is crucial for successful healing and vision restoration. While not all cases of retinal detachment are preventable, there are steps you can take to reduce your risk. Regular comprehensive eye exams, especially if you are nearsighted or have a family history of retinal detachment, are essential. Wear protective eyewear during sports or activities that could cause eye injuries. Manage underlying health conditions like diabetes, which can contribute to retinal problems. And, as we've emphasized, Be aware of the symptoms of retinal detachment and seek immediate medical attention if you experience any of them. Early detection and treatment are key to preserving your vision. The prognosis for retinal detachment depends on several factors, including the extent and duration of the detachment, the type of detachment, and the individual's overall health. With prompt and appropriate treatment, many people regain good vision. However, in some cases, vision loss can be permanent, especially if the detachment is long-standing or involves the macula, the central part of the retina responsible for sharp, detailed vision. Recent research is focusing on developing new surgical techniques and technologies to improve outcomes and reduce complications. Gene therapy and stem cell research also hold promise for future treatments of retinal detachment and other retinal diseases. Staying informed about the latest advancements can empower you to make the best decisions for your eye health.